Welcome to Majlis Podcast by Emirates Hospitals Group. Our goal at Majlis Podcast is to update you with the latest advancements in medicine in order to spread awareness and help improving health and well-being. My name is Dr. Wafa Faisal. I am a consultant pediatrician at Emirates Specialty Hospital Dubai, and I'm the host of Majlis Podcast. As we know, October is the Breast Awareness Month. And for this, my guest for today is Dr. Rita Sakr. Dr. Rita, before we start, please introduce yourself.
Thank you, Wafa. I'm Dr. Rita Sakr. I'm breast oncoplastic surgeon and OB-gynecologist at Emirates Hospital. And we really emphasize on every October about the awareness, the education, awareness and education.
So welcome, Dr. Rita. And as you know that the field of medicine is advancing so rapidly, what are the latest treatments in breast cancer that are available for the patients at the moment?
Definitely, we always have advances in the treatment as much as in diagnosis and the screenings. And you will be surprised, but we are now more into the de-escalation of treatments. So all the studies and the research and observation of the outcomes have shown that de-escalation is doing better. So less is better than more. And in many surgical treatments as much as medical treatments for breast cancer with a very good outcome.
All right. So as we know that also genomics is taking its place in the field of medicine at the moment. And I want to ask you if there is a role for the genetic testing in breast cancer in particular, because it is a disease that runs in families. So does it help in detecting the people at risk, or does it help in prevention maybe and in precising the management?
It's a very, very interesting question. And indeed, we emphasize to everyone sharing with the doctor the family history, sharing the family history, mother's side and father's side, because sometimes we consider as the mother's side the most important. Sharing the family history will help the doctor to analyze the risk, and then we might be candidate for genetic testing, which is a blood test to indicate if we have a mutation in a gene that makes us at higher risk to develop breast cancer or ovarian cancer. So this is very important because the patient has the right to know, and then we can emphasize and explain the preventive measures. It can be surgical or medical, but it is very important, as you said, to share the family history with the doctor so we can see if we are entitled to do the genetic testing, the blood test.
Yeah. This genetic testing is easy to do, because, we still think that it's not covered sometimes by insurance, and maybe some people don't like to do it not to discover. They don't want to know about it. So how is it really happening in the practice?
It is a blood test, so it is easy to do, it is easy to get, but as you said, we are still struggling in order to get it approved. Now, for patients already diagnosed with breast cancer, it can be approved, to my knowledge. Okay. Now, for family history or for risk, it is considered as screening, so we are still fighting, but in my opinion, it has to be approved. Yes. But we should recommend it, and we should all put our hands together in order to emphasize the important, and maybe we will get to it one day.
For sure, we will reach this. And moving to our second question, what are the most common misconceptions you encounter in your practice?
So this is a very, very hugely important question that we always emphasize. You can see on all social medias and all the doctors emphasizing this. Is mammogram safe? Yes, it is safe, it is safe, it is safe. I repeat it as much as we can. The mammogram is safe. It is not a reason to delay the mammogram if we think that there is radiation or if we think that it is painful. So it is very low dose, and all the machines are really secured. This is under measurement and securely international measurements. So it is safe. The mammogram is safe, and we should stick to the screening program starting the age of 40 on yearly basis and whenever it is required. So the mammogram is safe. The second one, the biopsy. The biopsy is safe. It doesn't spread any lesion. The biopsy is a tool. we have something on the mammogram or we have a palpable lesion, we need to know what it is so we can adjust what kind of treatment, what kind of management. So the biopsy is a tool and it is safe. It doesn't spread anything. If there is something, it's already there. So it's not the biopsy that will spread the issue or the problem or even cancer. So it is a tool for diagnosis, so we should really be careful from the false information and we should stick to the recommendation of the doctor so we can have a proper diagnosis and proper treatment.
Great. These are really very important information because we still hear them, unfortunately, despite all this awareness. But I'm sure it's a consistency that matters in the end. I want to ask you, because you are like the surgeon, you are the one who offers the treatments, and sometimes the treatments can be aggressive. So how do you balance between this aggressive treatment from one side and the patient's lifestyle, females, all of them? So what do you do for this?
Definitely. So we usually always try to explain in two balances the benefits and the side effects and complications and risk. When the benefits are higher, then we can help crossing the journey of the treatment. Of course, the journey will have positives and negatives, will have bumps and downs, ups and downs. So we will go through this together. So we will hold hands together, and even if we have side effects and complication, either from surgery or from medical, we will work with the patient together, trying to encounter and go with her through this aggressivity of the treatment. And we have ways now to try to reduce this aggressivity, either from the medical point of view or from the surgical point of view. So we can help through these aggressive moments, but explaining that the benefits are much higher and we can get through a solution. So we will work and through helping with both aggressivity, medical and surgical.
Yes, great. And in general, like if the breast cancer was detected at an early stage, how long is the duration of this journey of treatment? Because
so this is important, but we need to pay attention to the fact that everyone is different. There is no one story to everyone. There is no one journey to everyone. It's like fingerprints. Everyone's story is different. Everyone's journey of treatment is different. So definitely, early stage means better outcome, better survival. So the common thing among all those journeys, however different they are, is that early is better. This is why we are highlighting a lot on the early screening, either by the mammogram at 40 or even before. We highlight so much the autopalpation, self-examination. Yeah. We explain to the girls since young ages to learn about their body, not to be afraid of self-examination and autopalpation every month, because the woman and the girl will know her body more than anyone else. And if anything is different, immediately tell the doctor so we can catch whatever is happening in a very early stage, as you said.
So, but I just like, because I noticed from the people I know, they got breast cancer and thankfully they are now treated completely, but they passed it through a year or two at maximum. Is that right?
So this is what I'm saying. Each journey, we cannot generalize because every story is different. Longer. Sometimes we need to start with chemotherapy before surgery. Sometimes it is followed by radiotherapy, and then there is a medication. What is common among all those journeys is that follow-up. Follow-up is very important. So we do not stop when we stop the treatment. We have to keep following up after that. So the journey is from diagnosis to end of life. So we keep together, we are connected together until end of life, because follow-up is very important to keep an eye on whatever is happening. And even if something is happening again, if cancer is recurring, if there was cancer, then catching it very early is very helpful as well. Yes. So we can find a solution very early as well.
Very true. Despite all we say that about the awareness and the social media that's helping also in this awareness, but still a lady who is diagnosed with breast cancer, it is traumatic for her at the start. So is there a role for mental health in helping breast cancer patients?
Definitely, and 100%. This is why personally I always tell them we are taking care of you physically and mentally. We cannot take care of cancer just with medication and surgery. Not only breast cancer, it's any kind of disease, and specifically cancer. So there is definitely, we should work with the patient, definitely helping her husband, her children, her family all together from the mental health point of view as well. So it is very crucial in my opinion.
Very nice. Yes, mental health now is really started to be integrated more and more in all fields of medicine. My last question will be, Dr. Rita, is about, again, also the lifestyle, because today in the morning I was listening to a podcast about eating vegetables at an early age, even in the teenager years, like the phenols, and can help in preventing breast cancer and the microbiota and all this new, let's say, research that's coming. So what are the modifications on the lifestyle that our viewers, the ladies, can do certain steps today maybe to prevent the risk of breast cancer, whether they are still teenagers or a bit older?
So definitely, and lifestyle and the exercising, reducing fat diet, it's not just words, it was proven by studies. So reducing the high fat, reducing the fast food, having more vegetables and fruits in our daily basics, exercising. It can be any kind of exercise, but on regular basics. Stopping the smoking, even shisha vaping, those are like higher risk for developing cancer and breast cancer included. So those alcohol, if we can reduce as much as possible. So different factors, they were proven scientifically that they can reduce the risk of developing breast cancer.
Very true. Dr. Rita, thank you very much.
It's my pleasure.
Thank you. And thank you so much for the audience who were with us. Stay tuned for the coming episode.